I know you've been involved in many of the community engagements, and I know you're working with the White House faith-based organizations group, as I am as well. So how do you see that COVID-19's impact has helped to unveil what's been going on in terms of what the political policy or the political will is to do something about it? You may be actually more privy to those conversations than I am.
I think the thing that we have seen very clearly is really the disproportionate impact that it has, right? The numbers are all there. I personally have seen it first and foremost, just, being on the front lines in New York, having the first wave of COVID and being in the surge in the thick of it. It was an experience that I can't even really put into words. I try to formulate that a little bit in my TED talk, and I share this with people frequently because it is something that I would never want anybody to experience, and time again, we've come so far and we've made so much progress, but we sort of find ourselves in these scenarios again where we are unfortunately having these surges occurring. We had our second wave and our third wave, and it's really something at this point where we know where the problems are. We've seen it very clearly. It is not something that's like I said, can be swept under the rug. It is right in our faces, and we have to do something about it. So just seeing the mortality in New York especially, it was really alarming, the amount of disease, disability, despair, and death that was just coming in the wave, and just the number of people that were impacted simultaneously by this virus and the disease that it caused. And obviously we were learning so much about this novel virus and the disease that it causes, and we were really working in real time. But everything that we had learned until now that we know to be tried and true and to work for these type of illnesses was really ineffective. And so what happened is we were losing people on a daily basis, and it's something very difficult for us as medical professionals, especially as physicians, as I was saying, in infectious diseases. The great thing is that you have a treatment and you get people better, you nurse them back to their health, and to not have that and to feel completely crippled and helpless and lose people. Even my very first patient that I will never forget, was actually a young, healthy 20-year-old. And the narrative.
Wait, 20-year-old? This was back when New York was the state that we kept seeing in the news. Yeah.
Yep, exactly.
20-year-old.
So a 20-year-old. So all this time, I was following very closely what was happening globally, but the story was always that it was going to be the elderly patient, the one who's immunosuppressed, who's got underlying medical conditions, who's going to be at risk. And, those are really the people we have to worry about, and we should do everything to protect those people. But lo and behold, the very first patient that I had was a healthy 20-year-old with no medical conditions. And he was so sick that he needed to be hospitalized. He was gasping for air, and it was that feeling of drowning. And he had that look in his eyes that I'll never forget, the look that, so many of my patients continue to have, unfortunately, not knowing, whether or not they would make it. But that moment for me really changed everything, because I knew, everything was off the table, that, we think we know everything about this virus, and that was very early on. But clearly, we saw many young people be affected by this. It was really, really disturbing. But, we would see the impact, no matter what actions we took. We started dispersing as much information as we could and telling people to stay home and try to socially distance and work from home. Well, not everybody has the luxury of working from home. And this is where the inequities start building up, because who is then impacted by this? The people who are, don't have those luxuries, are essential workers, the people that are keeping us alive, essentially, right? And those are the people that were most affected, and really, who was there to protect them? Where were the resources to protect them? And that is what we saw day in and day out, how disproportionate this disease was, and how so many people, so many marginalized people in minority communities were just being hit by the tsunami of COVID-19, and day after day we were just losing people to this, and it's really highlighted the problems that we have in our healthcare system and the changes that we need to do, the infrastructure that is missing, and the healthcare access that we need, because this pandemic, we are still reeling from this pandemic. Absolutely. And we are nowhere. nowhere near out of it, but this is not going to be the first time that we're going to be in this situation. We've been here before. This is a whole other level, but we will continue to be here if we don't do something to change, the future.
So you're saying we have got to pay attention right now, look at what happened, why it happened, and fix those things that can be fixed as expeditiously as possible, because if we don't, the opportunities and the circumstances that led to this pandemic will come again. And as a virologist, I can say that that's true from a microbial point of view, but you're saying from the clinical point of view, from the healthcare system, that the system which allows these health disparities to continue has to be fixed, or we'll continue to see this kind of disparity.
Absolutely. And, losing one life is enough, but we're talking about hundreds of thousands of people. These deaths are all preventable, and we have to do something about it.